Hello everybody, so I am Rochelle Payne-Baum and we are here with the Barriers and Breakthrough show. I am the Pain Whisperer, that is my maiden name, yes, P-A-Y-N-E, and I'm a physical therapist, so I like to help people with their pain. Whether you have pain in your neck, your shoulder, hip, back, knee, foot, most people don't realize that some of those pains that you have are very simple fixes. And so I would love for you to contact me anytime and see if I can help you break through your pain and fix your pain and not have to go to the doctor and spend extra money for them to just go ahead and send you to the physical therapist anyway. So contact me when you can and I'll tell a little bit more about that. But so we are going to have our Barriers and Breakthrough show today, and our special guest that we have today is Allison Briggs. I actually met her a couple months ago, and she has a really fascinating career as a licensed professional counselor, and she's here in Pearland. So I just thought it would be great to have her on the Barriers and Breakthrough show because she deals with pain, and usually that is mental and mental pain and depression and things that people are going through. It's a type of pain that we really have to struggle with sometimes, and so it's great to have a good resource here to help us figure out how to get through some of our emotional and mental pains that we have. So I'm going to have her introduce a little bit to us, Allison Briggs, and tell us a little bit about your career and how you got started here, and then we'll kind of ask you some questions.
Okay. So my name is Allison Briggs. I'm a licensed professional counselor. I don't know how far back to go. I guess I'll just start with after college. After college, I went into the Peace Corps overseas for about 2 years. I was in Thailand for a couple of years, and I just grew a deep appreciation for different cultures, working with different people, and just kind of realizing that we're all looking for the same thing, which is belonging and connection, and just a reminder that we're not alone. So after the Peace Corps, I ended up becoming an educator, and I was in the education system for almost 19 years. And during that time, half of my time in education, I was a school counselor. I was a school counselor for about 9 years. And
what kind of schools?
Middle school, mostly.
Okay.
Preteens. So I seem to gravitate towards that group, but maybe because they're in that odd transitional period between, still being innocent, but wanting to kind of become independent and think for themselves, just seems like a sweet spot for a lot of, I think, the way that they, it's just formative years as far as them creating an identity separate from their parents. So I went into private practice about 1.5 years ago. So I'm pretty fresh and new to all of this. But probably a few months ago, I've had an interest in trauma. I accidentally stumbled upon a pretty amazing mentor who, she has her own group practice in Pasadena. Her name is Heather Lambert, and she's become a trauma expert. She left the high school. She was a lead counselor at a high school in Pasadena, and she has grown her practice in Pasadena based on the fact that she's learned EMDR, and she's been using that with clients, kids all the way up to adults. Okay, so I don't know those terms, so let's just go back just a little bit. So explain a little bit, what does trauma include? Like, what does that mean? Does that mean like a shooting at the school? That would it be to me, like for students? Or is it a car accident, or what kind of trauma? So there's little t trauma and there's big T trauma. And a lot of times the way that we think of trauma, we have a kind of broad, or I guess narrow definition of it. We think of abuse, rape, we think of a shooting, or a natural disaster. Mm-hmm. But there's also little t trauma. And little t trauma are being left out, being excluded, being made fun of, being bullied, going through a divorce, although that could be a little t or a big T trauma. Seeing your parents go through a divorce, even if it was a civil divorce. What happens is a lot of times there's a story that's tied to the event. And the reason I kind of talk more about little t trauma as it relates to more kids is because that's when those beliefs, a lot of times we're very kind of vulnerable to those beliefs, because kids are very
the not good beliefs about
the not
themselves.
good beliefs. This is the best way, for lack of better words, kids, and it's developmentally appropriate, really little kids, they're egocentric, everything's about them.
Yeah.
So if they hear mom and dad fighting and they happen to hear their name, they may think it's my fault, I'm damaged, something is wrong with me. Those stories, let's say that they weren't able to process it with their parents.
Yeah.
Those stories get stuck in their memory networks. And over time, because the brain is pattern seeking, the brain will continue to look for the same pattern. See, I'm damaged, I'm damaged,
Oh, yeah.
I'm damaged. And that's why little T trauma can be just as impactful as big T trauma.
Right.
They've shown
like the constant negative.
Yes, well, also because the brain is now seeking the pattern. Because our brains naturally, just to make life easier, if you think about it, like if I go to a grocery store, I want to know if I go to aisle 10, there's going to be cereal and not broccoli.
Organized. Yeah.
Right. So our brain needs to be able to file things into certain patterns. So if something really impactful happened to me, even if it was like a little T trauma, and I created a story about myself, because as kids, it's about them. That's how they take in information, unless there's someone clearing up that misunderstanding.
Yeah.
Even if they had the greatest childhood,
Yeah.
they may have these misunderstandings that then become bigger because, oh, look, the teacher called my name, I didn't know the answer, she gave me a look, everyone laughed, see, something is wrong with me. Well, that may happen to all,
Everybody. Yeah.
but something stuck, and then eventually over time, what you then see is an adult who has depression or anxiety or phobias. And then when we kind of connect the dots, a lot of times it's because beliefs formed at a very early age. And that's the amazing thing with EMDR, is that...
Okay, so that is really amazing. Like, if, as you're young, you keep doing the same negative patterns or looking for it.
Mm-hmm.
So, because you've made sense, you've tried to make sense out of something that's happened to you, but then when you see the same thing, you just still associate that with like a negative thing with you.
It could be that we're naturally wired to kind of seek out the same pattern. So let's say, for instance, as a kid, these different events happened to me, little T traumas maybe, and the belief I had about myself is something is wrong with me. It could be that later on you end up in a relationship with someone who's always telling you something is wrong with you, because the brain has went to seek that pattern. Or maybe they're not saying something's wrong with you, but you're finding evidence that they are. Does that make sense?
Oh, I like that, finding evidence.
So it could be either way. It could be either way. It could be very valid that the person they're with is emotionally abusive, and they're proving that story's right. Or maybe the person isn't emotionally abusive, and maybe it's not, but they're finding all this evidence. It could work either way.
Yeah.
But
so explain the EDMR. What does that stand for?
So it's EMDR.
Oh, EMDR.
And
EMDR.
And it stands for eye movement desensitization and reprocessing. It sounds very kind of woo-woo, but and I remember learning just the theoretical model in grad school briefly, and thought it was kind of weird. It sounded a little bit like hypnosis, because it's and it even sounds robotic, eye movement desensitization, like something futuristic is happening.
I've heard of some stuff like that.
But it's not hypnosis. That's not what you're doing, because the person has full control when they're in it. There's nothing's being put into you. You're not going into a deep trance. You're actually basically targeting. The way that it starts out, there's eight phases, and there's three different, it's three pronged. You focus on the past, the present, and the future. And you go through the 8 phases with the client. So let's say they come in to see you because they're depressed, and then we start to kind of drill down on what are some of the thoughts that you have about yourself. Let's think about your most recent trigger. Well, when my boss called me in and he said, you're going to be reassigned to this, I thought something is wrong with me.
Okay.
So we would start with the present. We could start with the present, and then I might say something, and a lot of times clients are like, no, that was 30 years ago. That doesn't matter that happened to me 30 years ago.
Right.
But
if you make a connection,
the brain doesn't care about that. We have the right and left side of our brain, or the right side of our brain it doesn't understand space or time. So what that means is the left side of our brain understands, okay, we're here on a Tuesday or whatever day. We understand we're in this office and it's almost 5 o'clock, right? We understand that. But the right side of our brain doesn't understand space and time. What it remembers is associations, like a felt sense, right? So
Right.
let's say when someone gives me a dirty look, my body kind of tenses up. My brain remembers a time that was like that.
Oh yeah, that's
Even if
interesting.
it was 30 years ago, it doesn't matter.
Memories are very
because the right side of the brain doesn't care about that it was 30 years ago. What it cares is I've now made an association between that look and then a belief I have about myself and a feeling that comes up in my body.
Yeah.
So you were saying something about pain. And a lot, that's actually what we tap into are several different things. The belief that the client has about themselves. And then also, where do you feel it in your body when it comes up? Well, I feel it maybe right here. What's the feeling? It's shame. On a scale of 0 to 10, 10, really feeling it, and 0, not at all. Where would you say you're at when you think about this particular situation? I'm at a 7. What would you like to believe about yourself? That I'm okay as I am. On a scale of 0 to 7, 7 really believing that about yourself when you think about this situation, and 0 not believing it at all, where would you say you put yourself? Well, I'm at a 1. So that means that they're really kind of struggling with that, and that might be dictating a lot of things. What I might do is say, we can focus on that present situation. However, a lot of times if we can kind of float back and go to the earliest memory or an earlier memory, that's going to generalize to everything else because that was the foundation. Now, some people don't feel comfortable with that, or they don't remember. They're like, no, there was nothing. Right. So really, ultimately, it's still up to the client. We might kind of say it's ideal to go back as early as you can remember when you felt like something was wrong with you, and sometimes they can bring something up. But we find something to target. Basically, we find a memory, a recent event, or it could be one that was really, really early. Like I said, that's the
trigger.
Yeah. And then once we find that event, that would be, I kind of skipped some of the phase, because I said there were 8 parts. I'm telling you, I think that's phase 2 or 3. Phase 1 is history taking. Phase 2 is, kind of giving them education about EMDR and also preparing them for EMDR.
Right.
Because a lot of times clients need a lot of resourcing and grounding techniques. So that's mindfulness, guided imagery, different things that can help them with symptoms that they may be already having, right? Yeah. Anxiety or depression. That also will help them when we start the EMDR process. The reason they need that part is because when we start the EMDR, what it is going to activate a lot of times is let's
more
say
emotions,
right. So I say scale of 0 to 10, and when they go back and they think about that event, they're at like a 5. We may start and they may go up to an 8 because what we're doing is we're activating it, right? So that the brain can process it and file it away where it needs to be filed to make sense of it. And every brain is going to do it differently. That's why it's not like hypnosis, because nothing is being put into you. The brain wants to heal itself. That's the amazing thing. Yeah. Just like if I've got a wound and it's a really big wound, and I put a Band-Aid on it, it's probably not going to get better. Well, what we do a lot of times when we're wounded as kids is we find ways to put Band-Aids on it, right? Like, I'm unlovable. Well, let me get in the relationship that's bad for me. That will make me feel lovable. So it's just a Band-Aid, right? Yeah. It's just a Band-Aid. So that's what we do. We go through life repeating these patterns going, God, why do I keep on not realizing that it's coming from deeper stuff? And so
is there a problem with your thinking? So if I'm understanding right, is it that you don't think highly enough about yourself, or that you haven't really processed it correctly? That you've always processed it like negatively, or interpreted it negatively?
Well, I think it's just that the brain is doing what when an event is too impactful, the brain just doesn't know how to process. So it's not the fault of the person. It just means that it got stuck. This is the analogy I use. This is going to be kind of a gross analogy, but this is the only analogy I can think of. If I eat like a lot of bread and I just get constipated because I can't, it's stuck. I need something to make it move through. It's not it's not like I'm not gonna, I might need something to make it go. So what happens is these events, or not events,
kind of like traffic and getting stuck.
It gets stuck in these memory networks, and they just keep getting reactivated. So it's not It's not that the person is bad or they're consciously thinking, I'm going to go look for the person that's going to show to me that I'm unlovable. It's just a stuck belief. That's why a lot of times typical talk therapy doesn't work. Because you can say, well, no, you are worthy, you are lovable. But if it's not a felt sense, they don't feel it.
It doesn't change it.
It doesn't sink in. So if they had a certain feeling, that's why we will say, where do you feel it in your body? Because most likely, that's where you felt it in your body when you first started to believe that. So, there's a somatic connection to it.
Right, yeah.
And
Physical.
so, and so we end up, working with whatever target they're ready to kind of work on. And then as we start the eye movements, so then I'll say, hold the worst part of that incident in your head. Notice where you feel it in your body. Remember the belief that you said, something is wrong with me, and just go with that. And then we start the eye movements. Eye movements is not the only way to do it. You can do it with tapping. You can do it with like buzzers.
Acupuncturist.
Tapping is like back and forth on your. I think there's a couple of you can do it this way or this way. There's also the butterfly hug. You can do with buzzers. They also have some type of light thing that lights up. It's got all these dots, and you look back and forth between the two lights. You just find what works best for the client.
Very cool.
So we kind of may have to experiment to figure out which one is going to work the best. And about 25 to 35 sets of one. We'll stop and I'll say, take a deep breath, let it go. What are you noticing? They may say, I notice my stomach feels more tense, or oh my gosh, I remember this time that da-da-da-da-da.
Yeah.
And then we'll say, go with that. So a while ago, just to kind of go back to what I was saying earlier, with the wound, a lot of times when it's like we're taking the Band-Aid off, right? And putting peroxide on.
Opening it, making it
peroxide,
hurt. Yeah.
it's not, you probably know it's not a medicine. All it's doing is cleaning the dirt off so that the body can heal.
Right.
That's what EMDR, to me, that's the analogy that I use, is that nothing is being put in. We're allowing the block to be removed so that the brain can do what it needs to file that old belief where it needs to file it to make sense of what happened to it. And then once we've gotten down to a 0, it could be a few sessions. It really depends on if they have complex trauma or what. But let's say they go down to a 0.
Yeah.
It could be one session, a few sessions. Then we say, okay, now, at the very end of processing during a session, we may ask on a scale of 0 to 10 when you return back to that target incident, where are you at now? They may say, well, I'm at a 4 now, or a 3.
Okay.
Eventually, we try to go down to a 0, and then we'll say, okay, now go back to that target incident, bring up the belief, I'm okay as I am. Notice where you feel that in your body. And then we do the sets until they go up to a 7. And we target whichever other memories they think are impacting their current situation. So if they find themselves in codependent relationships, they keep on getting in relationships with people that are destructive or toxic or abusive over and over and over again, it can break patterns like that.
Yeah.
So
let me just recap. So the EMDR. So you're taking a traumatic event and you're helping to desensitize how that feels, where in the body, and then change it kind of to a better place where they feel it, where it all of a sudden the actual feeling is a good feeling.
It's a felt sense. So it's not
they feel better about the event than they did. Right.
So this is the thing, is that with beliefs, people aren't going to believe what isn't valid, right? So what happens is we explore that for them. So let's say that they say, I'm okay as I am, and we get to a level, we get to a 5, but we can't go any higher than that. Then what I might ask, or a clinician who does EMDR might ask, is what prevents you from being at a 7?
Yeah.
And then we explore that. They may have some valid reasons, and then we may have to target something else And it could be that so it's not, they're not going to believe things that aren't logically no one's going to believe. So it's not like we're trying to create a potion.
Some kind of, it's actually a very
valid,
realistic
thing. So, but that they can feel, because I think what happens with a lot of people is that they may find themselves fighting between their head and heart. So what that looks like a lot of times is logically, I know that I'm okay as I am. Right? Yeah. Logically, I know I'm okay as I am, but I don't feel it because this guy didn't call me back. But I know I'm okay as I am. So they find themselves fighting inside. Well, what we want to do
that right now a lot.
So what we want to do is help them feel in line with what they know is the rational belief. Does that make sense?
Yeah.
So
can you use this with somebody that has an eating disorder? You know, like does the EMDR work with people that have anorexia? You know, some of the like eating disorders.
I think that they've done clinical. What they first started out with, the population they started out with initially was veterans and people who had PTSD. Then they started to say, I wonder if you can do this with people who have depression, who have anxiety, who have phobias. And they started to realize that most of what people experience when they come into counseling, those are just symptoms of something, usually unprocessed trauma or unprocessed grief, and what they have is a symptom of that.
That makes sense. So something bad happened, they don't realize and don't make the connection.
And so it's manifesting in this way. This is the way it's manifesting.
Yeah. Okay.
Am I going to say that EMDR is a cure-all for everything? No. Yeah. I mean, I definitely don't think it's a cure, but I think that it's definitely superior to a lot of different types of therapy because it's combining all of the therapies that have been shown to be effective. Yeah. It's combining experiential therapy. It's combining therapies that are, exposure-based therapies where there is desensitization. Right. It's combining cognitive behavioral therapy, somatic therapy. I mean, it's Gestalt. It's combining all of these different therapies into one.
Yeah.
So that's what makes it pretty amazing.
Yeah. I've done a little bit with our physical therapy and some of the nurses and people I work with. We had some training that we use with some of the elderly people for helping their memory processing and helping them feel better about doing exercises and therapy and that kind of thing. And we use like specific eye movement techniques, tapping, and we actually practice it on several of our patients, and it seemed to really help, like deep breathing, where you actually associate, sometimes their memory or stress patterns, or when you change that up with their brain, somehow it really like opens up like a better feeling about themselves. They actually do better, they move better, and so I really see the connection between the physical somehow and the thought processes.
Absolutely.
Where you think good, different thoughts.
Yeah, and I
mean, it's not the same thing as trauma, but I've seen it work. Really helps the patients.
Yeah, and I think our brain does. We make these associations, to different things, and we don't sometimes even know until we're going through therapy. Oh my gosh, I never realized that's what I was associating with this over here. Yeah. They seem disconnected, and they're connected.
Yeah.
And sometimes I think it's also validating for clients to understand where it's coming from. It's not just coming from just, because some people come in and they're like, well, I've been told, why can't I get it together? Or they feel guilty and they beat themselves up and they judge themselves. And it's like, you can't help it. It sounds like you're using every tool in the toolbox that you possibly can. Yeah. But our unconscious, is powerful. And it can really drive us to, make decisions and do things and feel ways that we feel pretty powerless about. And so we end up kind of shaming and judging ourselves on top of all of that.
Yeah.
So I think it's also validating when before people start the process of EMDR, that kind of educational part of saying, it's, it's really, you can't help what you don't know, right?
Yeah, for sure.
And so I think that in and of itself can feel kind of empowering,
I had a great question, I forgot it, but so do you do, with kids, adults, like, how does somebody know whether they need to come in? Like,
what are the signs? Or
what's the point where somebody feels like they should come in to get help? You know what I mean? Like, you don't want to, you have a stigma of like, okay, I'm going to a therapist. You know what I mean? Like, how would you know how you could benefit And
so I'm really hoping that, you know, our society, I think the stigma is slowly lessening. I think especially with younger generation, it's not as much.
Oh, I remember my question.
Okay. Did you want to?
Yes, okay. So kids are on social media. So I want to know what your opinion is about kids being on their phones nonstop and not being able to develop good social skills, because I feel like some kids don't develop anxiety, and so they're on their phones all the time and they're spending all this time and they isolate themselves, which doesn't help them as well. That probably seems to exacerbate anxiety. So I don't know what you think about social media and how that makes it maybe worse, exacerbates it. I don't know. What's your opinion on that?
Well, this is kind of what I believe. I think that, like I was mentioning earlier, that when we have unprocessed trauma or unprocessed grief, and there's little t trauma and there's big T trauma, that what we're going to do is we're going to find what we can to put a Band-Aid on it because it's hurting.
So the phone could be a Band-Aid.
So there's shopping, there's gambling, there's sex addiction, there's food addiction, there's raging, there's working a lot. It's just another vehicle.
Yeah, that's
so a lot of times I think that I would ask the question, okay, did the anxiety come from that, or was the anxiety there so they're using that as a Band-Aid?
Right.
If the wound wasn't there, would they be so driven to go there? Now, I do think that sometimes you can obviously do environmental things to kind of manage some of that. And I think that, you know, some of that could also just be habit and just family routine, and honestly some of the realities of our lives these days. I mean, you know, so
that we have more stress because of how our lives are. Is that what you
I think that the reality of our lives is that a lot of parents and adults already feel so overstressed that sometimes they just use okay, can you just that's fine. Just go ahead and use that so that I don't have to.
Just get on your phone.
Right.
Look at that iPad.
Right.
Just be quiet for a minute so I can deal with this.
Right. So I think some of it's just it's so embedded in our culture. So I think that I think that that's a systemic issue.
Yeah.
And then, I mean, I think there's things that you can do on an individual level.
So that's my next
family
question.
level.
So what kind of things? Just really fast. Like, you know, exercise, in my opinion, would be super helpful.
You mean as far as?
Just, to dealing with the stress and, you know.
Gotcha. Well, you sometimes have to remove the environmental issues.
Okay.
So a lot of times what I find is that clients come in and they say, okay, this is I love analogies, so I always use metaphors.
That's good.
But let's say that, like, you know, a client comes in and they're like, I'm working 60 hours a week, and I have, 2 kids, and this one's got behavioral issues, and I need to learn how to manage stress. Okay, the analogy I would use is you're in an oven, and you're asking me, how do I manage being in the oven? So sometimes the reality is that, well, let's look at the environmental issues. There's environmental issues here. And so, of course, everyone has a threshold.
Yeah.
And what happens, I would probably...
How you can deal with it to what
so
level,
what
point.
I would do is I would dig deeper, is I would say, what's driving you to work 60 hours? What has led to all of this? Because there's a story that has created this life.
That's good. That's
and
really
so
good. People can
hide
behind it without having to try and deal with it, and they just escape sort of.
So, I mean, a lot of times people, they can go to the internet and find out, oh, you can eat more bananas, you can eat, sleep 6 to 8 hours a night, drink, however many glasses of water, and that's fine. That's that's just a way to kind of manage the symptoms, but the symptoms are still there. What has created that life that you're now in that has you so stressed out? What is what's happened to get you to this point, and what are you holding on to keep this? Why are you holding on to this to keep it? And sometimes and to just validate that, it may be that there are certain environmental things that are too hard to change, and that's understandable. So then it is more symptom management, but I always tell them the reality is we're managing your symptoms. But if you take if a seed is not growing, there's a saying I saw somewhere, it was like, if a seed's not growing in a certain soil, what do? You change the environment it's in.
Sure.
So you can sit and keep watering it and doing all this stuff, but it's like putting icing on a mud pie.
Not gonna work.
So there's deeper stuff. There's so if someone's coming in and saying, so when I'm hearing managing stress, some of the things that come to mind is, okay, I'm hearing perfection. What's going on? Because you want to come in and be able to do more.
Right, right.
How do I just stay on top of all of this stuff? What's the story? That's what I would kind of dig straight into that and say, what's the story? Well, I tell myself I have to be perfect. If I'm not perfect, then I'm worthless. I'm insignificant.
Yeah. Now, I've learned a little bit about personality, you know, like your 4 types of colors, like your red personality, your blue, your white, your yellow. Do you do any personality testing?
I love personality testing.
Yeah, okay. Because once I understand that a lot about me, then I can understand, like, why I'm a certain way. You know what I mean? So I don't know if you help people with that. But
I love personality. I love the Myers-Briggs. That's my favorite. But Enneagram, that's more. So Myers-Briggs is great because it helps you understand.
So that's like a categorizing of how many? 4 personalities?
There's 16 different personality types in the Myers-Briggs. But what people don't know, because they may go online.
That's your favorite?
That's my favorite.
Okay.
Because that is very. It's not. I mean, you can go online and take a quick little test, and it's probably not going to be very accurate. It goes a little deeper because the person that was the catalyst for all of that, he didn't create the Myers-Briggs, but the people who were inspired to do it was a psychologist who basically said that we have different mental brain processes. Some people, they go out into the world and they get their energy from being out in the world. Some people get their energy from their inner world. Some people, we all need a way to evaluate information. We all need a way to take in information. So we all do that in a different order. And how we do that will help us kind of understand how to grow, basically what our weaknesses are, and how to kind of grow our strengths to work around our weaknesses. And it's kind of neat just also to find out what different kinds of careers are good for you, what different environments are going to bring out the best version of you. I actually, when I do...
That's good for teens, right? Like, especially if you're trying to decide what you want to be as a high school, like, senior graduating, like, I don't know what I'm going to do or what would be good, right?
So a lot of times, if there's someone struggling with their identity or struggling with who they are, I, a lot of times, include in their treatment plan doing personality profiling. And so we, usually in the second session, I have a treatment plan that I share with them, and that's something that like I said, my mentor had kind of trained me to do. It's very unique. There's not a lot of counselors that do that. But in the very first session, I ask, what brought you here? What are the goals that you have? Usually I've already looked at all their intake paperwork because I have a private portal where they can send all that information. So that gives me time to go over it so that they're not having to start all over again when they come in. And then, they kind of let me know where they're at, how they would like their life to look different. And in the second session, I come back and I have a treatment plan that basically says, this is what you told me your goal was. This is where, or this is what you said the problem was. This is what you said your goal was. How are we going to know the objective is, like, how are we going to know that you're getting there? This is kind of how we're going to measure it. We may talk about that in the first session too. I might say, how are you going to know that you're feeling happier? Well, and so, then in that treatment plan are some of the interventions. So we talk through that together, and it's kind of gives us a map. But sometimes one of the interventions is personality profiling. Sometimes one of the interventions is EMDR. It just depends on the client, or it could be both,
Kind of what So if I wanted to come in and, like, just talk to you, like, would you suggest a certain number of sessions? Like, do you do a consult and then, like, recommend, this is what we could do to help you? Like, how would somebody know what you could do to help them even on one session? You know what I mean? So usually in the second session in that treatment plan, I will say the frequency and how long I think it'll take. And then we talk about any barriers. So I'm like, I forgot the other part of the treatment plan is the diagnosis. A lot of people use insurance, and so we're required to have a diagnosis when we use insurance. So I make sure that I ask them, different questions to come up with the accurate diagnosis. And when I come back and I say, this is what I see as the diagnosis, and here are the reasons why, we talk through that as well. I say, based on what we talked about and what's effective for this type of
issue.
Yeah.
This is about how long I think it will take. This is how frequently I think, you should come. I think it's medically necessary based on what you've kind of told me.
Right.
What are your thoughts?
Yeah.
What barriers might prevent you from being able to come this amount of time? Let's talk that stuff out, because in that second session, it's collaborative. So even though I've created the treatment plan, they still get to decide, okay,
What
this
they're
is
gonna
going to
work
be
on,
right.
how it's gonna work,
Like
yeah.
this seems too short, or this seems too long. Okay, well, let's work around that. What are some different ways we can maybe spread it out every 2 weeks?
Yeah.
So that's a collaborative thing that we do together. And at the end of every session, I kind of
Summarize.
we'll also say, I'll take notes at the end out loud with the client and say, okay, this is kind of what we talked about. And these are some of the things that you said that you want to work on. How do you feel you're at? And then we kind of have some little celebrations, because a lot of times they don't see their own progress.
Yeah,
they don't
good.
see their own progress. And then
Yeah,
I'll ask,
okay.
what do you want to take away from today?
Good.
So, at the next session, we'll kind of follow up from where we left off.
So do you take notes so that you can read back, or how do you keep up with that?
It's collaborative. So a lot of therapists will take notes during session. I don't do that, because I don't feel like I can really be present. And so that
do they
also
take notes? Like, how do they know what to do? Like,
usually there's at the next in that treatment plan, since we've kind of said these are the things we're going to work on, then at the end of every session, I might say, what do you want to work on next? These are some of the things that are in the treatment plan. What do you want to work on the next time we come? Now, some people are very, very flexible, and they don't want a lot of structure. Some people want a lot of structure.
Yeah.
And that's part of what we kind of figure out, and that's,
for sure.
the first couple of sessions.
Yeah.
Some people just want to come in and they want to talk and process and get, the relationship is really important for, and which is understandable.
Yeah.
So there's, a lot of value in just getting to the point where the client feels, okay, I trust you, I've kind of tested you out, we've had a few sessions, now I'm going to start opening up. And that's okay. That may take time. So we may not, and then there's other people that are like, I want a plan, and I want,
Let's get this done.
So I think it just depends on the client. There's going to be clients who come in and they're like, okay, well, what do we do today?
Yeah.
But there's going to be clients that they're going to be more, like, I just need to come in, I need to talk before we get to this other stuff. So it really depends on,
Right.
the client.
So I have to ask you a personal question, because I found this out today, and this is a very personal thing, but my nephew, I just found out from, my mom called me earlier that he was in the hospital and was hospitalized. He had suicidal thoughts, and I know my family members are going through a big struggle right now. And so what would you suggest would be the first step? Like, they don't live in the state, but what would they do to find the right kind of counseling, or what kind of program, or what do you do with, where do you even start with that? Like, what do you do?
So you said he did commit suicide?
No.
He attempted
well, he
it, or?
had just thoughts that were really,
okay.
Serious, and, just, I don't know if he's actually hospitalized, but anyway, just, so it's serious. It's something you should take seriously when they explain that kind of thing. So I just don't know.
I think the first thing that I would, find out if he has a plan, or if it's just thoughts, or if he's thought about it. If he has a plan, then he's at a higher risk, because he has a plan to actually do something. Right. So in a
Is that
situation,
usually a bipolar kind of situation?
oh, there's no way I can make that assessment.
Yeah, you have no idea.
I can't make that assessment from
So
not knowing him.
They would need to have him get an assessment done of that, for sure. Like,
I mean, it really depends on, if he said that he had a plan and that he planned on following through, then, I would look at, something maybe more intensive. But if he said that it was something that he was just kind of, if he said, well, no, I don't have a plan, but I've thought about this before, then, I would recommend therapy to start out, and the therapy could make an assessment whenever he comes in.
and if they're a higher risk, then what do you do? Like,
if they're higher risk and they think that
they need
he's
to be
actively,
in a place, right?
if he's actively suicidal, then then it would be more some type of intensive facility.
Now, where do you distinguish between doing like the EMDR and medication and that kind of thing? Does it go together, or
They don't. I mean, with EMDR, if a client is on medication, we don't discourage them from being on it, because if they're on it and it's keeping them stable, then, and they've come in that way, then we're going to, work with that. So they may process through things and their symptoms, almost completely disappear. And then they may say, you know what, I want to come off of medication. The problem with that is if they start to come off of medication, they may need to go through EMDR again to reprocess, because the medication kind of acts as a little bit of a mask. So that it may be that there's more processing they actually need to do.
Because the feelings get more intense, probably.
That it may be more processing that they need to do. I would say that if anyone is going to come off of medication, that they would do it with, the doctors, kind of watching them, and there being collaboration between the doctor and the counselor who's actually working with that client. So that's really the only caveat to medication or no medication with EMDR.
Okay. Well, I know we could talk for a long time because I have so many questions, but maybe we can do another part 2 where we can address some of the other things. What are some of the other things you do besides the stress, anxiety, depression?
I mean, those are the typical things.
Okay,
that
so that's your specialty.
I would say that I am probably becoming more specialized, and my plan is to become certified in EMDR.
Oh, okay.
So that's what I'm going to be using with a lot of the clients that come in, regardless of what their diagnosis is, because and obviously with their consent, if that's something they don't want to do, which is completely understandable, then we'll use other types of modalities and therapies. It's not, EMDR isn't for everyone.
Right, okay.
But I do think that it's helpful with a lot of different, a lot of the different symptoms that kind of happen to people,
Cool. Well, awesome. So I'll summarize a little bit. So some of the barriers that people might have, like anxiety, depression, post-traumatic stress. What else did you say?
I wanted to add a barrier that you had mentioned, and I know that we kind of got off on another topic. You said, how do you know, I think barrier of even walking into a therapist's office.
True.
That's a barrier. That's actually a barrier. And I heard, this was actually, a client actually said this to me, and it has stuck with me. He said, a therapist friend of mine actually said there's 2 types of people. There's people who are in therapy and people who need to be in therapy. and so, I mean, I think that the
people who are in therapy and people who need to be in therapy. So only 2 kinds of people? Is that everybody? That would include me.
So, I mean, self-disclosure, I'm in therapy. And I will probably continue to be in therapy because even as therapists, we experience vicarious trauma. What that means, and people that are in any helping profession, they experience either vicarious trauma or compassion fatigue. It's the same. It's different names.
Interesting, compassion fatigue.
Well, it's kind of the same thing.
I do that a lot, especially when patients die.
So if you're constantly around people who are telling you their experiences and their stories, we have to be able to take care of ourselves. And the only way to kind of be the best version of yourself is to make sure that you are taking care of yourself. So,
So listen up, all of you nurses and therapists out there that are working with people, hospice nurses especially.
Firefighters, police officers.
Yeah, of course. People that see trauma a lot, people in the hospital, you medical professionals. Don't be afraid, right? To get some breakthroughs, break through those barriers by just getting someone to talk to and help you process some of that, right?
Yeah, and teens, especially I think that in the area that we live in, I know that there's been a heightened awareness and even some fear that's gone along with some of the things that have happened with attempted suicides in the area, or suicides. So, being able to talk openly with others about their own personal experiences. I had to go to a therapist when I went through this. That takes the shame out of it.
Yeah.
There's nothing wrong with needing help. We all need help at some, we all need help to some degree or another. We're not in this alone, so.
That's great. Well, that is awesome. I hope you've appreciated this great professional counselor here, Allison. I've learned a lot today, and I think I'm going to look into doing this EMDR. I'd love to just sit down and talk with you anyway, just because I think you could help me with just giving me my ideas for me as well as my family and some of my therapists that work for me as well, and we should probably. Do you do anything that's kind of a group setting where we could do
like group EMDR or?
Yeah. Some kind of those techniques?
That's probably beyond my scope of practice.
Oh, okay.
I'm not saying that there's probably not clinicians that do things like that. I've heard of things like that. I'm just not at that. I'm not at that place right now. But
well, that's an idea.
But yeah, that's true. That is an idea.
So, where all of us could feel like we're getting some help,
Yeah.
and people could ask questions.
I think definitely I can offer group education just about trauma and how trauma is processed and what happens with the brain a lot of times when we have trauma.
Great. I think we'll have you do that for some of us, so that would be wonderful. So I hope you've enjoyed Allison's comments today and instruction for us, and that you can look at some of the barriers that you have. If you have any barriers, that there are breakthroughs available for you and help you to overcome some of your mental pain and emotional pain that you might have. And so glad you joined us with the Barriers and Breakthroughs show, and hopefully, how do people get a hold of you then? What's the best way? Do you have a website?
You can go to my website. It's on-being-real.com.
On-being
real.com.
So it's like on being real, but put dashes in between
Yes.
that .com. So Allison, and it's www.
You can just type in on-being-real.com.
onbeingreal.com.
Yeah.
Just dashes in between.
Yeah.
And she's here in Pearland as well, Allison Briggs.
And I
So-
have a Friendswood location too.
Oh,
So,
Friendswood too.
Yes.
Great.
Yes.
Well, thank you so much for being on the show today, and look forward to next week. We should have Becky Singleton with EnviroShield. She'll be our next guest next week. So any of you that want to have a breakthrough session with me for any pain, physical pain, that you have, any kind of neck pain, shoulder, back, hip, knee, ankle, I can help fix some of those simple techniques that we have that will get rid of your pain and save you a trip to the doctor, save you some money. So look me up. You can Facebook message me for a breakthrough session at ilivetolive.com. So we look forward to hearing from you soon, and look forward to seeing you next week. Have a great day.
Bye-bye.
Bye.